Hello, I'm Darrell DeWald, Washington State University's Vice President for Health Sciences and Chancellor of the WSU Health Sciences Spokane campus. Today we have an opportunity to have one of our lead researchers here with us for Health Sciences Update. Dr. Lois James, who is a professor in nursing, is going to talk with us a little bit about her research. But just as a reminder, WSU faculty, staff, and students are committed to changing society through their research. They address challenging situations. They not only do the research, but they look for opportunities for intervention to help humankind. And I think that really does describe some of the work that I know about what you've done. But Dr. James, if you would, please give us a little bit of background about yourself and give us a start on what you do in your research, please.
For sure. Well, first of all, thank you for having me.
Of course.
My background, so I'm Irish, and I came here from Trinity College, Dublin, which is where I got my undergrad. And
Excellent school.
It is an excellent school. My undergrad is in psychology, so I've always been extremely interested in why we make the decisions that we make. And when I came here, I actually came to Washington State University to get a master's and a PhD in criminal justice. Okay. And I became very interested in why police officers and other first responders make the decisions that they make. And that really led to my entire research trajectory, both in implicit bias and how biases affect us, and also in fatigue and sleep and shift work and how those various states affect the decisions that we make as well.
Very good. So give us a little bit more information. How long have you been at WSU? And you're in the College of Nursing, so give us a little bit more background there.
Yeah, so I'm trying to remember, 2007, I think, is when I came to WSU for the master's program. Yeah. I graduated in 2011. And then I bounced around a little bit. I did some adjunct work. I had a postdoc with Brian Vila, who's my academic mentor and, you know, an academic father figure, I suppose. And then I had some great collaborations with the College of Nursing from very early on. And I kind of, almost on a bit of a whim, thought, well, maybe, you know, maybe they might take me, and so I applied, and it worked out very well. I'm on the tenure track. Okay. Hopefully, apply for tenure soon, and yeah. So it's been fun. It's been a great home for me, nursing. It really has.
So for our viewers, explain a little bit, what is the tenure track for a faculty member? What does that look like? Sure.
So as an assistant, you come onto the tenure track as an assistant professor. And typically after 5 years as an assistant professor, at that point you would apply for tenure, at which point you move to associate professor. And you know, there are of course various benchmarks in terms of grants, bringing in grants, publishing papers, establishing some expertise in a particular field and becoming recognized in that field. And those then are the things that would be considered when you're going up for tenure.
And they do consider the body of your research and what you're discovering and then how that can be applied. So give us a little bit of insight into the areas of research that you and your team are doing right now, and who supports that research, and what your team looks like, please.
Yeah, absolutely. I have two major lines of research, and although I consider them separate because most of the grants focus on one or the other, they're extremely complementary and they do intersect quite a lot. The one is the bias research, and honestly most of the work that I've done with that thus far has been funded from the National Institute of Justice, and then from various other contracts as well with local and state departments. The sleep research, I received my first R01 from the Agency of Healthcare Research and Quality, HRQ. I always have to think through that acronym.
And that's part of the NIH, right?
Exactly.
The National Institutes of Health.
A sister agency.
Okay.
Of the NIH.
Okay.
And that's what's funded my kind of a lot of my shift work and fatigue research. And then again, I also have had some contracts from state and local departments looking at fatigue. And that particular line of research actually spans many different populations. So I've looked at police officers, military personnel, nurses, combat medics, elite athletes.
Wow.
Let's see, I'm sure I'm forgetting, other first responders, firefighters. So, you know, any occupation that experiences shift work or jet lag in the case of athletes who travel for sport, and where the consequences of making a mistake are high. And of course, you know, in the different professional groups, that can mean very different things. But
Yes.
in a number of those professional groups, the consequences of making a mistake are life and death, particularly in the medical field and in the criminal justice arena.
So your background is very interesting in these areas that you've moved into. I have a colleague that will ask sometimes, kind of give us a little bit of the headlines, what you and your team are finding in these areas of research that you're focused on. So maybe in the bias area, give us a sense of some of the headlines, the discoveries that you're making there.
Yeah, one of the big headlines, and this is very much in line with what pretty much every other researcher who's looked at this has found, is that humans are biased. Humans have implicit biases.
Yes.
Implicit biases are subconscious associations between
So we
different
don't
things.
necessarily control those implicit biases, right?
We mightn't even be aware of them.
Okay.
Right? So they're subconscious or semi-conscious, and we as humans have them. And you know, there's evolutionary roots for that in you know, bias being a survival heuristic. In the ancestral realm, it was very productive to fear people who look different from you.
Okay.
You know, it helped keep people alive.
Yep.
And you know, just because that is no longer productive in modern society doesn't mean that it isn't something that humans experience, because it's something that we've, you know, evolved with, that we've developed. So implicit bias is a universal human phenomenon. That's one of the headlines.
Okay.
A bit more specific to my research, police officers appear to be at even greater risk for implicit biases.
Okay.
And in part, you know, if you think about it, it's not justifiable, but it's understandable when you think that an officer, for example, that works, let's say, in a particularly high crime, predominantly Latino neighborhood, is going to develop subconscious associations between Latinos and crime. It is next to impossible for that not to happen. Okay. So the thing that's really important is to teach officers to be aware of that and to counter that. And that's kind of what I would say is the biggest headline from our research, is that's what's really necessary. And that's what's pushed me from purely a research role into a training role and, you know, intervention, development, and evaluation.
So this is fascinating, and the implicit bias that you see, let's say, in law enforcement, and you are working with law enforcement professionals in trying to give them an understanding and awareness of what they might be experiencing as implicit biases. How would you describe kind of the outcomes of the report? What are you hoping to achieve when you use the example, which is a very important one, about law enforcement engaging with populations? So what are you hoping to see as an outcome of not only the research, but the interventions that you're doing with these professionals?
Yeah, the first one is to promote fairness in police decision making. Okay. You know, to actually, to my mind, interventions, especially training interventions, they have to be behaviorally based, and they have to be measured behaviorally as well. Okay. You know, I mean, we can change attitudes, we can change intentions, but if we don't change behaviors, you know, it's not going to have the same kind of societal impact that you know that we need in the United States. So what I'm really hoping to find is that there will actually be a behavioral impact in terms of promoting fairness and equality in how police make decisions. A follow-on consequence, you know, potential effect of that, and the ultimate goal, of course, is to actually improve police-community relations. and to enhance the outcomes of police-citizen encounters, to reduce the number of mistakes that are made.
Excellent. So that is a very poignant example of the linking of your psychological training and your background with behavioral sciences and then the criminal justice system. So that's fascinating to me, and I think it would be to our viewers. So let's then look at, you said there's a relatively close connection even with your sleep research. So if you can, maybe give us a little bit more insight there. What are you discovering? What are the actions that you and your team are taking?
Yeah. So from the sleep side, we know from a large body of research now that when we are fatigued, we are less able to control ourselves. We're less able to manage our temper. We're, our interactions with others are affected negatively. And when you think about that in a policing context, I mean, when you think about it in any context really with a professional group that deals with the public day to day. So I mean, of course, the medical profession is another extremely important professional group to study when you're looking at fatigue. But first, just to talk about police, even if officers are quite self-aware, even if they are familiar with the concept of implicit bias and they try and manage that in their day-to-day lives, their ability to do that is significantly degraded when they're fatigued, when they're sleep deprived.
But not too surprising.
Yeah.
Okay.
And unfortunately, just like it is very difficult for officers to not be implicitly biased, it's also very difficult for officers not to be fatigued.
Yes.
Because it's shift work, it's long work hours, it's oftentimes working when the body is saying it's time to sleep, so there's circadian disruption from shift work, and it's a stressful, complex job. And all of that, really adds to the issue of police fatigue. So I personally think that the two major problems facing that profession at the moment are implicit bias and what that means for police-community relationships, and police fatigue and what that means for decision making, and also for officer safety and health. When we know an awful lot, as from excellent previous research about the long-term impact of sleep disruption on the health and even mortality rates of police officers.
Yeah. Well, it's easy to access, even from where I sit, the importance of your work, and I appreciate it very much. Give me a little bit deeper sense of what is it, the internal drive that makes you want to do this particular work? Are there examples in your life that are especially impactful? Are there things that you experience? What is it that the viewers might want to understand about what Dr. James has experienced and where you are and what you're doing?
Yeah. I think for me, one of my lines of research was inherited and one was self-driven. So the one that was inherited, of course, is the fatigue research. When I came here, I met Dr. Brian Vila, who is widely considered to be the father of police fatigue research. He's written the book Tired Cops, and most of the foundational work that we look to is his.
Amazing colleague and mentor.
Amazing colleague and mentor, absolutely. So, being right here with the Sleep and Performance Research Center, which is just such a world-class facility.
Absolutely.
Is been an incredible
what a team.
Opportunity. What a team is right, and what a team of senior scientists that are so willing to take somebody like me and to take junior faculty and lift them up and push them forward and say, here, the heir is apparent.
I think you're pushing them forward. So.
Well, and I hope that as I continue to grow as a researcher, that certainly will be the case, and that I'll contribute in my own right. But to have that opportunity early on was pretty remarkable.
Okay.
The bias piece came from me, so that was something that actually it all originated from some secondary data. So it was a police fatigue experiment, and I took the data from it, and I thought, hey, I think I can look at this research question that I'm really interested in terms of, are officers making decisions differently based on the characteristics of the people that they're encountering in these scenarios. So that came from me, and that came from me, I think, for several reasons.
Okay.
One, it's something that I was noticing more and more as a real issue, you know, especially post Ferguson in the United States. You know, I could see it as something that was very, very damaging to the police profession and very damaging to American society. So it was something that I was extremely interested in because of that. As you can imagine, it's quite a culture shock coming from Ireland to the United States. Not saying that Ireland's, you know, not without its problems. Of course it is, but yeah, it was eye-opening, and it was something that I thought, you know, this is something I want to understand, and down the road, this is something I want to affect and change if possible.
Thank you for your great work in this area. I do think for decades to come, we're going to see benefits from the work that you're doing. So give us a little peek into your thinking about the future of your research. Are you going to kind of stay in the pathways where you are? Do you see some opportunity for expansion? So give us a little bit more of a sense of that.
Yeah, I definitely see opportunities for expansion in the bias realm.
Okay.
You know, and particularly with the medical profession, you know, the healthcare system. So one of my next major goals, I have a grant pending at the moment, is to expand my bias research to the nursing profession, and then from there, you know, hopefully expand it even more so within healthcare. You know, I think that there's been a lot of research now that's showing there's a problem. There is some disparities in healthcare delivery that could be contributing to disparities in healthcare outcomes overall. That needs to be better understood, and we need to start thinking very seriously about interventions that can address that. You know, implicit bias is one of those things that, you know, it sometimes can fly under the radar. Sometimes it's not particularly popular to talk about, but it's important.
Well, I think you, and I would say thank you, as the spouse of a nurse who I think changes the world with her work. I appreciate your endeavors there too, and I think you can really help us to understand some of these important issues in the medical field and health delivery and how we do better. So before we wrap up, I would just say, are there any other things that you think of? This has been fascinating and encouraging to me to hear about where your research is and where it's going. Are there any other things that you think of that you'd like to just project to our viewers about the work you're doing or who you are?
I think just actually off your last point about nurses, you know, I often get asked why, you know, how do you fit with the College of Nursing? And I really do want to take the opportunity to say that I think nurses are the best people in the world. I think they're the absolute center and soul of the healthcare system. I don't think anything works without them, and I think that we're moving more and more towards a system where they are, I mean, they're already integral, but they're much less supportive and secondary. And you know, I'm so excited to be part of that. I'm excited to expand my research to include them, to have these incredible collaborations, and I'm very happy to be where I am.
Well, I think that's a great place to end, because not only do we have a terrific College of Nursing here at WSU, but those people in that community, the nursing community, they truly are committed to serving and changing society for the best. And we've heard a lot about that today. Dr. Lois James, I just want to thank you for joining us for Health Sciences Update. It's been a pleasure.
Thank you. Thank you.
Thanks so much for what you're doing. Thanks for being here.